Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
I think you have answered to some of them, because the question is, if the urine test is negative for mold, does it mean that the child has no mold? So you said that urine is just actually a small piece.
1%.
1%, because it doesn't. It's just kind of more related to detox, rather to what's really going on in the brain. And there is a question: how accurate is mycotoxin profile test? So it's actually similar, because a similar question, this Great Plains test, because it's also urine test, so it's also probably showing just a part of the problem and not the full.
Yes.
But it's maybe a bit more accurate. I don't know if you want to comment on that. And the last question is, which cytokines are elevated in mold sickness? Are there any cytokines? If I'm pronouncing correctly.
Yes, you are. Yes.
Yeah.
Yes. Okay.
And just one last question, not to forget, because you have mentioned that you started treating your son when he was 1.5, and most of us have done this as well, and we see some improvements, but maybe not sufficient ones. And then we know when kids are 7-8 years old, parents even start losing hope that something will happen. So even when child is older, and you said when your son was 9 that then you discovered mold and that he did great. So this is really something encouraging for us. So if you comment shortly on that as well. And I think we are going to round up soon, because we still have 10 minutes. Okay.
Yes, that's all right. That's all right. Yes, absolutely. Don't worry about the age of the child. That again is a myth, I feel. If there are medical conditions, now, all right, consider this, right? Because most of us don't, because we are autism moms. Okay. Now, if you had a choice, okay, you have autism in your child, and then there are all these life-threatening medical issues. Okay. If someone tells you that, okay, your child has all of these life-threatening medical issues and your child has autism, we cannot do anything about the autism. Would you like to treat the medical issues? Wouldn't you? Well, of course you would, right? So it is very important to investigate all kinds of medical issues without even thinking about the autism, because these are life-threatening. You will see on social media, again, if you look at groups, if you do your research, you will see that multiple organ systems are affected. These are living things. All microorganisms are living things. And what do living things do? They reproduce. Every living thing has a reproductive cycle. Lyme borreliosis, it's anywhere from 22 to 32 days, depending on the internal good or bad or worse environment in the body, they grow. All co-infections and infections grow. Okay, so there is going to come a time when there is going to be multiple organ damage. There's going to be autoimmunity. There's going to be, autoinflammatory conditions, right? There's going to be brain damage, even more white matter lesions. So MS, Parkinson's, ALS, in all age groups, it has been associated, of course, cancer, right? In all age groups, this has been associated with biotoxin illness. Biotoxins meaning it includes everything: mold, Lyme, co-infections. It includes anything that produces biological toxins. Okay, so keep that in mind. There is no age limit to that. I mean, I was much older when I started treating myself, and in my grand old age now, I've never felt better. I haven't felt this good since I can't even remember, maybe early 20s, was when I felt, this good. The pain, the inflammation, the stress, the PMS issues, the anxiety, right? Depression, suicidal thoughts. It's just, you don't understand how the neurotransmitters are affected, how the gut is devastated. So many neurotransmitters are manufactured in the gut. 70% of your immune system is in the gut. So anyways, so I think, you understand that. Now, speaking of which cytokines are elevated, you can visit survivingmold.com and you will get a lot of information there. Okay, look under resources for lab testing, etc. And there's going to be a full proper explanation, which is, far beyond the scope of today. But yes, everything, all of the markers, the transforming growth factor beta 1, complement C4a, matrix metalloproteinase 9, those are not available to be measured anywhere other than the US, unfortunately. Okay, it's not just your simple, IL-9, IL-11, those are your innate immune system associated cytokines. It's far more complex than that. Okay, so this is when there's mold exposure, there is your innate immune system is stuck. So it keeps producing inflammation. And then, inflammation by itself does not trigger your adaptive immune system, either because of genetic HLA predisposition to mold, or because Lyme disease is suppressing your adaptive immunity. Okay, so if the adaptive immunity does not turn on and get rid of the trigger, what does the innate immune system do? Keeps producing more inflammation. So it becomes a vicious chronic cycle of inflammation. And that is where, Crohn's, colitis, Parkinson's, and all the other diseases that I mentioned to you can happen in all age groups. Okay, now I'm going to look at the questions again. There was one other which I did not. Okay, if the urine test is negative for mold, does that mean the child has no? Right. So the function of your immune system, one of the most important functions of your immune system is to tag the toxins and schedule them for removal. Now, mold toxins can be removed through the liver, through the kidneys as well. Now, if your immune system is not working 100%, for our kids, it's not. Okay, if it is dysfunctional, then the immune system, depending on how dysfunctional it is, you will see limited number in your mycotoxin test. All right, so just because you are not seeing mycotox panel results off the charts does not mean that you or your child doesn't have biotoxin illness. If you've been exposed to mold, grandmother's house, or vacation house, or at home, right? AC is leaking, whatever, right? And anywhere that there has been mold exposure, there are symptoms, then that needs to be addressed. That becomes an important point to be addressed. Don't depend on any test because it's very complex. It's, for myself, couple of years ago, right? Because there was lockdown and what have you. I'm like, okay, so what would I like to study further? And I wanted to study the immune system further. It's so fascinating. I wanted to be able to further customize my treatment protocols by understanding it better. So I was admitted to Harvard Medical School. And at Harvard recently, I completed my advanced certification for, immunology, and it's mind-blowing, on all of the latest research, which we learned about, and it is so intricate. It's such a complex. Can you even imagine the immune system keeps track of exactly what is going on in each cell in your body? We have trillions of cells. Every single cell the immune system keeps track of. And there are so many complex mechanisms and mediators. It's so beautiful. God has given us everything we need to keep our body healthy. But it is the environmental toxins, it is infections and what have you, the food we eat, the food we feed our children, that ultimately the vaccines, for example, all of these toxins that we just, it's so much abuse that our bodies go through.
Wow, wow. Yeah, exactly. This is something really to think about, and congratulations on going to Harvard. This
Oh,
is
thank
really,
you.
this is really great. I think what we lack here in the region is really the knowledge about all these, issues that are going on in the kids on the spectrum. And I just want to mention that we were speaking before that you are willing to give your knowledge to others, especially to doctors, to spread this knowledge further, which is very much needed. Just want to mention that we have several doctors in our group also today who may be interested in your seminars and lectures and I think we very much need people in the region with this knowledge, and of course it takes time to get the knowledge. So whenever you decide to make a group for Eastern Europe, let us know, and then we will try to find even more doctors who may be interested, because it would be really kind of pity and a waste not to gain this knowledge from you, and thank you very much for your willingness to do that. And maybe just for as the last question, just maybe like what kind of advice message to parents with autism spectrum disorder you would give to our group and other parents who are struggling in everyday lives, seeing their kids suffer and then the whole family suffers. What would be your message to them?
Of course, I will address both of these. I did a pretty large physician training in Poland and Lithuania, where a few years ago, where many practitioners came in to learn, etc. Now, the practice has gone to a whole other level. My practice with mold biotoxin, there's a fully herbal approach, and BioNexus formulations and what have you, right? Which are targeted. So maybe one day, once all of this pandemic issues are over, I could fly down and just do, take a few days and maybe see your children, give my advice, and also spend a few hours in training, whoever wants to come for the training. So that's one thing. Another thing is I'm looking to have soon, I'm looking to acquire land where I will be building a BioNexus Academy with small guest houses. It'll be completely nonprofit, and parents of children, other practitioners are most welcome to come and stay at the guest houses for up to a week, and learn just hands-on with me. So that is something that I will keep you posted about as well. Real estate right now is insane right here, I think all around the world. So once interest rates are beginning to climb already, so hopefully all of these inflated housing prices, land prices will start to collapse, and I'll be able to acquire good land that I'm looking for, and it's going to be in a free state. So we'll be able to travel, do whatever we want. It should be good. So that's one. Now, second is, you asked me, what message would I give to autism families? Number one message would be, there is always hope. Now, don't fall for gimmicks that are out there. There are many. Just look at the science, do research, approach it as a family. It's very important that to heal, because autism is a life sentence for the whole family. It's not just for the child. So healing requires the whole family to cooperate. And, it is best if everyone decides to heal together. It really shouldn't be that one family member that, oh, I'm not allergic to gluten, I want to eat what I want to eat. That's just not fair to the mother. It's not fair to the child. to have, all these cookies and sugar and gluten and dairy and all this in the house when you're trying to heal your child. So cooperation from family members, healing everybody together is very important, because things like marcons, mycoplasma, parasites, and strep, MMPS, these are very easily transmitted amongst family members, right? And another thing is also H. pylori. So all of this needs to be healed together if your child is going to get better. Otherwise, you just keep infecting each other back and forth. Okay. So one of my really good mentors is Dr. Sergey Dorokov. And Dorokov is an ENT surgeon from Russia, and he migrated to Germany, and amazing mentor. He's married to German lady Elizabeth, and I learned so many things from them, from making wonderful chicken soup all the way to treating the whole family. I don't believe in any kind of invasive treatments. We tried, and they were all complete failures, band-aids, and waste of time and energy. But anyways, so we went there for cryotherapy of the tonsils, right? Tonsils are an important part of your immune system. So tonsillectomy, if the child has pandas, was not an option for me. So we actually traveled to Germany several times, and thankfully the airlines were so helpful, because my son was so little in a wheelchair, and they actually gave us the whole row of seats. They said, he should lay down and make him comfortable. I mean, it brings tears to my eyes, but God bless all of those, stewardesses, and the airline staff. They were so sweet, so wonderful. We couldn't afford to buy another seat because all these treatments were so expensive, and we got 2 extra seats where even I could lay down and rest with my child, because he had separation anxiety, and that's one of the symptoms of PANS. But one thing that I learned from Dr. Dorokov was all 3 of us, the entire family, got treated. The biggest chicken was my poor husband. Like, oh my God, I need to freeze my tonsils. It's, that this long liquid nitrogen frozen rod is going up my sinuses. I'm like, just be quiet. This is for Brian. So Alex got it done. I got it done. And after the first treatment, I still remember, Best Western in Mönchengladbach in Germany, right? We actually flew into Dusseldorf. But anyways, we all went to sleep after the procedure, and we slept for 16 hours. This was the best sleep of our lives. I mean, I hadn't slept until then, because my son, every 2.5 hours, he would wake up coughing or in pain or something, right? And it was wonderful. We were symptom-free for 3 months. We went back 4 times for my son, 3 times for myself, twice for my husband. And then, we started seeing wonderful gains. And then I realized that all of us had to be treated. So we all 3 did mold detox. Like I said, MMPS, mycoplasma, mold, marcons, parasites, and strep. So the whole family was treated. You have to be in 100%. You can't expect to get recovery if you're not all in. That's the thing, you will have to detox, not just basic detox, but also, I found that I had to detox toxic friends, toxic family members, like goodbye, later for that. If you cannot support me, you're not on my Christmas list, it's okay. Once our journey is over, then I will, if I feel that you deserve it, I will get back in touch with you. And seriously, I haven't regretted that. So this is the hardest thing you will undertake ever in your life, but the rewards are amazing, amazing.
Thank you so much, Dr. Dashore. We have one more question, but I don't know if we have time for this about breastfeeding. Is this something that you would recommend?
Is breastfeeding in family? Yeah. No, absolutely not. Of course you should breastfeed. No. Especially the colostrum, especially for the first couple of months. No, there is nothing wrong with breastfeeding. I myself did that for almost 1.5 years. Now, do remember that all body fluids contain Borrelia. Okay, all body fluids, semen, breast milk, etc. So you will be passing Borrelia to your child through breastfeeding as well. So if you suspect Borrelia, then limit it to the first week or so. The first week is the strongest antibodies, colostrum, that's really fantastic stuff that you can give your child. Yeah, but after that, investigate very carefully what formula you are giving your child, okay? I mean, organic, low allergy formula is what is best for your child. In many cultures, and I'm looking into this more, many cultures use milk like, camel's milk or donkey's milk, which is very, even llama milk, which is very similar to mother's milk. But, there's no research studies that have been done that it can be fed to infants. It can be, but there's no research studies that have been done. So I'll be doing a full podcast on camel milk as well. In fact, I have several lectures on it already, but we'll be doing a podcast on that. I've used camel milk instead of IVIG, which is an invasive treatment. Again, if you know how to do it, it can be done.
Wow, thank you so much, Dr. Dashore. I think we could continue talking for a couple of hours, and it's really great that you suggested that you may come to a region and stay for a couple of days. That will be really wonderful. Let's plan to do something like that, and also to see our kids and to share your knowledge. And thank you also for sharing your personal story, which is extraordinary, I would say. And when we hear from a mother with the child with autism spectrum, how you went through all these struggles, this really encourage us to make our own, to continue actually our efforts to heal. And what you said about the whole family, treating the whole family is also very important. Maybe we haven't thought too much about that, but we'll do so in the future. So thank you for all these messages, and thank you for your time and sharing your knowledge and your experience with us and with other families. It's really invaluable.
It was an absolute pleasure to meet all of you guys today. I'm happy to do it.
Yeah, great. Thank you so much.
All right. Well, so I hope that was a very stimulating experience for those watching as well. Like it was for me. It was absolutely amazing. So thank you for joining me today. And I will see you back here at the next episode of BioNexus Health Podcast, Autism Uprooted. You must have gathered that, it is certainly possible to uproot autism, isn't it? All right. Thank you. Be well, and namaste for now.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.